Hi, this is Josh. I'm a pharmacist with pharmacisttips.com, here today to talk about furosemide, the 20 milligram, 40 milligram, 80 milligram dosages, and the side effects associated with this. First off, what is furosemide? Furosemide is a loop diuretic, sometimes called a water pill or a fluid pill. It just helps get excess fluid out of the body. It acts in the kidney at a place called the loop of Henle. What that does is it prevents the kidney from reabsorbing sodium, potassium, and chloride. And so since the kidney can't reabsorb those, the body has to flush it out with water or fluid, and that's how we get that excess fluid pulled off the body because of this. Those extra salts take that fluid with them. In the US, it's sold under the brand name Lasix, and it's used to treat edema or fluid retention and sometimes high blood pressure. So what are the common dosages of furosemide? It First off, it's generally taken early in the day as you'll have to use the restroom. Of course, that excess fluid has to be excreted from the body. Edema, anywhere from 20 to 80 milligrams. Sometimes they'll even start you on a low dose of 10. The max dose is 600 milligrams. We rarely see that, and that it would be something your doctor would have to work you up to. Um, but that does seem to be the ceiling dose. High blood pressure, usually if it's used for high blood pressure, it's going to be taken twice a day, and doses vary from 20 to 80 milligrams. So, that'd be 10 milligrams twice a day up to 40 milligrams twice a day. Again, up to your doctor. So some of the side effects associated with furosemide, because of the excretion of sodium and potassium, it has an effect in the kidney that can concentrate uric acid, or the acid that causes gout in the body. So it can increase chance of you developing gout, especially if you're prone to it. So that's something you and your doctor will have to chat about if you've had an outbreak of gout before, or an episode of gout. It can also cause headache. Sometimes it can affect blood sugar and blood sugar medications, so it could cause your blood sugar to trend higher. It can cause low calcium, low potassium, low magnesium. Those are all things your body or your doctor will probably monitor for in labs, and may have to replace some of those, especially potassium often has to be replaced, or your doctor may encourage you to eat a diet high in potassium. It can cause muscle spasms, and other side effects can and do occur. Some of the more rare or serious, sometimes it can affect the hearing. It can be toxic to the kidneys sometimes. Occasionally, it can cause some blood disorders, ringing in the ears, anaphylaxis, or just like a really serious allergic reaction to it, and rash. uh, that we should know about furosemide. It does seem to work best on an empty stomach. However, if you're prone to stomach upset, or it does upset your stomach, it can be taken with food. And like I said, the potassium supplementation is often required just due to this medicine making your body let go of potassium, and potassium is important for many things in the body, and especially the heart and things like that. We should avoid alcohol. If you want to have one drink per day, you should run that by your doctor and see if they're all right with that. Alcohol has a diuretic effect, so it could cause a serious drop in blood pressure, make you faint or dizzy. We want to avoid NSAIDs. NSAIDs are like ibuprofen and naproxen. Those medicines can counteract the effect of furosemide, so it could cause the fluid to not be released from the body. That could increase your blood pressure, it could increase your risk of heart attack and stroke. So if you need something for pain, you'd want to chat to your doctor and pharmacist about that. Sometimes they'll have you monitor your weight, because of course that fluid has weight in the body, and some people, their dose is adjusted by their weight. Also, if you're taking this medicine, sunscreen can be a good idea, as this medicine can make you more sensitive to sunlight. And like I talked about a little bit, we want to watch for dizziness or low blood pressure, especially if you're dehydrated. And then this medicine takes more fluid off the body that just could cause you to feel dizzy. It could cause a drop in blood pressure, especially when you're sitting and stand up. You could get faint or dizzy. So you need to be careful of that. And again, we talked about the effect on blood sugar. You'd want to monitor your blood sugar. Let your doctor know if it seems to be affecting your blood sugar, and then they can determine whether the medicine needs to be adjusted or changed. I would appreciate it if you'd subscribe to my channel, especially if you found this information useful. I'd encourage you to always talk to your doctor or pharmacist if you feel you're having side effects, if you're worried about interactions, any other questions about stopping, starting medications, always speak with your healthcare provider. Again, thank you for watching, and I do have more, a summary about this at pharmacisttips.com/furosemide.